Hello, everyone. Thank you all for being here. I know folks are just starting to come into the waiting room and joining in our session, so we'll give everybody just a minute. And we wanted to just take a moment to pause before we get started, given sort of the past 24 hours that I think we've all been experiencing. So just to give us a moment. Thank you all so much for being here, for meeting the moment, early intervention in a changing world. This is chapter 2 of our 3-part Learn at Lunch series hosted by Help Me Grow Inland Empire. I think I see some familiar faces and names, which is great. For those of you who are here for the first time, welcome. We're really happy to have you. And for those of you who joined us last month, thanks so much for returning. It's great to see you again. We're really looking forward to today's discussion, which of course is incredibly timely right now and important. And so we really hope that you find it useful for your work and how you're meeting children and families in this moment. I'd like to start this session by just learning a little bit from all of you about what you're seeing in your work with children and families. So we're going to kick things off with this quick poll to get a sense of what things you're noticing in this new phase of pandemic life, which I think will help guide our discussion today. So I'm going to have my colleague launch this poll, but I'll just give you a moment to think about this question and react to this question. Over the past few months in your work with children and families, have you noticed more, less, or the same level of concerns or developmental delays as before? So just to get a sense of where everybody is, and we'll share some of those results in just a moment. I'll give everybody about a few seconds to complete. Wow, this is really interesting. Okay. Thank you. Thank you. This is really helpful. I'm seeing a lot of results coming in. Why don't we go ahead and share those with everyone? It's really interesting. It looks like about 73% are noticing more concerns and delays than before, which is really interesting and I think helpful for guiding our conversation today and actually really evident of the timeliness of it. So thank you all so much. It's really helpful. Okay, well, why don't we get started? For those of you who are joining for the first time, I'd like to introduce myself. My name is Iris Alent. I'm with Viva Social Impact Partners, and I'll be moderating today's session. And as I mentioned, this event is hosted by Help Me Grow Inland Empire and is made possible by a joint investment from both First 5 San Bernardino and First 5 Riverside in partnership with Loma Linda University Children's Health. So big thank you to them for hosting this event. A couple housekeeping things that I do want to note before we get started. Everybody will be in listen only mode throughout today's session, but we really strongly encourage discussion with one another as well as with our plenary speakers. So please feel free to use that chat box, add your questions or your reactions. And when we get to the Q&A portion of our time together, we'll address as many as we can. Even though we would love to see all of your faces, I know that the past 24 hours has been a lot for all of us. And so if you want to disable your video at any point, please feel free to do so. I really want to encourage folks to take care of themselves today. And then I do want to share that we have subtitles and transcripts enabled for everybody who would like to use them. So if you do want to, there's a little button at the bottom of your screen with the closed captioning symbol. You can click that and get those launched. And then, of course, for those that are wondering, we are recording today's session. You probably noticed when you joined the call. We will be sending out the recording to those that registered afterwards in case you want to, revisit some of the great talking points that we have today, but we will not be sharing the slides. I just wanted to make a note of that. Okay. Okay, so for today's agenda, the past 2 years have really been a struggle for all of our communities. And as more and more families are beginning to re-engage with systems of care on a more regular and consistent basis, I think by our poll, it's pretty evident that we're discovering that the ways that we thought about identification and referrals and supports for children pre-2020 may not actually make sense in the same way in our new world. And so there are a lot of considerations that we all should have front and center as we start to connect with these families on a more regular basis. And so for the first part of our hour together, we have the enormously great privilege to learn from our fantastic plenary speaker. And then we're going to spend the last 10 to 15 minutes answering as many of the questions that come through in the chat box as we possibly can. Okay, so to kick us off, I would like to start by introducing Dr. Ronald Stewart from Loma Linda University Children's Health, who is also the Help Me Grow manager for Help Me Grow Inland Empire. So Dr. Stewart, I'll hand it over to you.
Thank you, Iris. Greatly appreciate it. Welcome, everybody. And it's great to see you for the second installment of the Help Me Grow Inland Empire speaker series. It is my distinct honor to introduce to you Dr. Kiti, who joins us from Loma Linda University Healthcare, where she is the Director of Psychological Services for the Department of Pediatrics. Dr. Kiti also serves as a medical director for the Inland Empire Autism Assessment Center and is a professor in the Departments of Pediatrics and Public Health at Loma Linda University. Over her 26 years as a pediatric neurodevelopmental psychologist, she has established expertise with infant and toddler high-risk populations, developmental disability, trauma, and pre- or postnatal substance exposure. We are so grateful and excited to have you here today with us, Doctor, to share more about what you are seeing showing up in children because of the last couple of years, and to talk about what considerations we should all be making when we think about early identification and connecting our families to the appropriate services to meet their needs. Welcome, Doctor.
Thank you so much for that invitation, and also for the introduction today and for this opportunity. I'm going to share my screen and okay. And look forward to some questions in the end where we can have some discussion. So I'm going to move through the topic pretty quickly because there is so much breadth and depth to this topic. And what I want to say is that, certainly the needs are complex, and with what's happening in our community with youth, harming youth, and just all the complexity of that trauma is compounded, and we are just seeing such a layer upon layer and this impact. And I'm hoping that today we can spend some time to really start thinking about what this means, and do a little bit of a journey. So I think I actually shared, there we go. So we're going to spend a lot of time looking at how this pandemic and kind of where we are now has impacted children. And it is very expansive. So I want us to look at certain elements briefly, and then in the end, hopefully integrate some thoughts that we come away not with all the answers, but thinking about that there's a need to ask questions, and there's a need for answers, and there's a need for us to work together. Older children who abruptly change their life, and younger children who had an absence of things that were there, and specifically children who have developmental or social, emotional, or behavioral concerns, and what this last few years has done in terms of impacting them. So, when you're thinking about it, there is a lot going on. Why this topic? Well, everywhere, last 24 hours capitalizes, but everywhere in the last several years, the topic has been on stress and mental health for all of us, but certainly for children. That we realized right away that there was going to be a delay in identifying things going on with children, because you need a community to identify things, and children need to be in the public eye for that to happen. And the delay of interventions, or even the type or modality, the increase in environments that weren't healthy for children, all of this encapsulates as a perfect storm for both missed and misdiagnosis. And it brings us, those of us here together today, in a call for action, because I feel very strongly that while we all are here because we have a passion for children, that we all do know that because there is so much going on and there's so much need, that often things just move along because of that urgency rather than being thoughtful about really what are the things that we need to be okay addressing. Just like what happened in the last 24 hours and in the last couple of weeks with multiple situations where it's hard to go back and try to figure out what's going on because it's a very, very difficult topic. It's hard to go back to the last 2 years and figure out what it is these children need because it's a very, very difficult thing to see how it's impacted the children. But those of us who are here together and we're from the Inland Empire and we have these entities in our community like Help Me Grow, like First Five, like the agencies that you each represent, that we can be a voice and advocate for the fact that we have to look at things that are hard and things that are difficult, because if we're going to make a difference in the trajectory of our children who've been impacted by the pandemic or current situations, we have to realize that perhaps maybe we didn't always make the right decisions, but we can make collaborative Help Me Grow decisions together. So I want to just highlight a few things that make perhaps the foundation of why this conversation becomes so important. And one is by a construct we call the pandemic echo. And as you can see from my picture on this slide, that if we think of COVID and that impact, it's very significant, but it's the tip of that iceberg. Below is much deeper are the consequences of the indirect impact of the pandemic or the response to it that are not necessarily related to COVID itself, but are related to the fact that our response does have its consequences. The other thing that I just want to underscore and highlight that I think we all need to validate for each one of us, we have been in stress and survival mode. That has consequences, right? That has, yes, there are many things that make us resilient, but we have to look at the fact that we've been in stress and survival mode. And the thing is, each one of us, I was just in a training for learning to tell stories because they're so important to grasp what's really going on. Every single one of us here has a story to tell about what's happened in terms of the stress or the impact of the pandemic or the pandemic echo in the last couple of years. The thing is, these stressors have been enormous. And normally when we go under this kind of stress, we have a broader support network that we can reach out to connect to and say, you know, they're going to be my support right now, and I'm their support during this time and their support during that time. And guess what? Everybody was in that same kind of stress, so it was hard to do that reach out. I know for me, I had very significant losses in my life, but it was hard to do the reach out because you knew that everybody was going under a great deal of stress. I have the privilege of having friends around the globe, but this is a pandemic that was around the globe, so even that kind of reach out wasn't as available or possible. So our social support systems were stressed. So that's made this a very, very unique situation. But one, perhaps because we have this commonality that we can come together and meet the need of children because we know how it's impacted us. The other thing that I wanted to highlight as we think about what are the needs of the children in our community is the issue of transition stress. When I was in graduate school those many years ago, it was kind of striking to me when I looked at the Holmes and Raw, which was the scale that we used to measure stress. It was like, what are the most stressful things? Well, right on the top, even above loss through death, was moving. And I was like, what? I was in graduate school. I could have probably moved at the time with things in my car. But it isn't just about what you have amassed around you. It's because when you move, everything changes. Like the daily routines change, where you get your groceries, where you do this, who's your support networker, how you organize your day. Your whole world changes when that happens. And let me tell you, with the restrictions that we had and the kinds of things that we did in order to address this pandemic, we had that immense stress because everything changed. It changed in every way possible. And we know that in the Holmes and Ross scale, it shows that this adaptation to change is what makes it so stressful. And daily hassles can really add up. And that's often because we are creatures of habit. So there's a certain amount of transition stress with any change. But think about this: when the change is ambiguous or not desired, that stress is even more intensified. And as ambiguous as it was for us as adults, can you imagine what this was for children who didn't understand what was going on, and we didn't really have a lot of answers? So that ambiguity of what's happening and how and why is very intensified. Then we go from that to what I call forward to the past and back to the present and back and forth, because we've had this back and forth that's happened that makes it even more confusing. And as difficult as it was to stay at home, for many, it's going to be a much more difficult to transition out. Now, I want you to take your mind and think right now of the mind of a young child who was explained in whatever way we could possibly know. It's not to put blame out there. It's just an understanding. What did we know, and what did we tell children about why they should stay home? And does that now scare them about going back out? And that's without all the other complications. It's just, and what does that mean for us? Because if we can't address it for ourselves, how do we address it for the children in our world? And this back and forth makes that ambiguity more difficult. So I wanted to share those things just as a premise, as a backdrop to when we think of children, let's not think of them as just presenting in our office or presenting for a service or presenting for whatever. And there's a behavior we need to fix or some development that we need to address. But this is a child who just went through a few years of pandemic, that there's all kinds of complexities that we don't even know the ramifications of as yet. But if we take a moment to consider those things, I think we will make much better decisions about how to help them and to help guide them, because they are resilient, but we are a major part of that resiliency. So what was this, a lot of this stress is about the concept of risk. And I just want to address it just very briefly. We don't have time to really go in it, but I will also at the end share a resource which talks about it a little bit more. But I think what we're addressing right now is the issue of risk. Now, we address it every day. And I'm sure for families right now who send children to school, they're addressing it in a much more conscious way right now. But no matter what and no matter what day, we are all looking at issues of risk because it's the possibility of something bad happening, and it's very personal. So to take it away kind of from the emotion that we might be feeling right now, I just want to take it to a different example. I, prior to the pandemic, flew a lot. I did a lot of travel, a lot of trainings. I went to a lot of different places, but I have friends who don't ever want to go on a plane. That risk was too much for them. They just did not want to take that risk. And we respect that. On the other hand, I don't ever want to jump out of planes. That my thing is not to go skydiving. right? That is just not something on my to-do list. But I have friends who have done it and loved it. So every single day, we may not consciously do it, but we are calculating risk. And it's how we look at that and understand it that makes us be able to move into the world and to reintegrate or integrate or do the things we're going to do. But one of the things I want us to remember, particularly for the families that we're serving, is that risk is personal. And rather than judge it or determine that somebody should do it this way or that way, we need to realize that for some people, this is a very psychological process we're dealing with in the world right now, which is why mental health issues are sky high and why we're dealing with some of the ramifications we are right now. But for some, things are going too fast, and for others, it's going way too slow. But let's remember, this is so individual. It is like grief, and we will all do this differently. My word of the day is grace. I can't know everything that makes you make the decisions you're making. And some of them I'd like to help guide you because they may not be the best ones, but I don't want to be there to judge you. But I want to be there to give grace and to help you. But we do have to do this. And it's clear that we have to do this. There are some who don't ever want to engage in that social sphere of the world anymore. But we do need to do this, and it's very clear when we look at the children. So let's do that. Let's move into that. First, I'm going to say this impact of the pandemic. At the Autism Assessment Center, we asked parents to tell us what the impact of the pandemic has been for them. And the children who come and the families who come to us for a variety of needs, but definitely that there's some developmental or behavioral concern. And they talked to me a lot about social isolation, that part of it, the virtual learning, which was difficult for many children, or the shutdown of resources in the community, isolation from friends and family, and increased screen time. That was very significant. Or family stress, like how do I balance my work with my children and I'm the educator now, or I have to go in because I'm an essential worker, but there is no school. All of those things, the lack of space and lack of boundaries, the financial burdens, which are even growing more now, not less, and no respite for the parents from this. The other thing that they talked about is that for children that they didn't have concerns for mental health before, or they did, regardless, there was an increase in depression, anxiety, suicidal ideation. We're going to talk more about some of these. I'm just telling you what the parents report, but I'm going to talk to you a little bit more about some of these. But the sleep problems and poor appetite, can you imagine how stressful the day is anyway? And then the child's not sleeping at night. How does that caregiver wake up the next day and work? So these things are really, really been stressful for these families. And I tell you right now, there's some families come in and I'm like, where have they been? Can't they see all this child needs so much help? But they've been going through a lot, or they haven't known about how to get those services, or there's so many ors we don't know. But just there's so many things going on. So let's think about it. I have such good friends who are occupational therapists, and they've helped me as a neurodevelopmental psychologist to think about when I'm working with somebody, what is their occupation? What is it that their life's occupation is and they need to do? And for children, it is education, it's learning, it's playing, it's socializing. That is developmentally what children need to do. And guess what? All of those things were significantly and dramatically impacted almost overnight for children. And then the caregiving relationship. What about children who were not living in homes that to begin with were very safe, but now there was no eyes on them? Or their caregivers are now overmax stressed and they had this delay. So we were in a perfect storm for children to have had a lot of significance. So thinking about children and learning, We know that many neurotypical children who didn't have delays, they were negatively impacted. In fact, some school districts have told me that 50% of the kids failed last year. They weren't AB students, but they just could not handle the way education was being done. Not blaming schools, just saying we got to look at it. How do we work together on this? And early childhood development and identification lag. So there's these little ones. Right now, I'm working with children who are 4 or 5 who would have gotten early intervention, who didn't, who now were a year or 2 beyond their language delays or the fact that they have hearing issues or motor issues. So for children with neurodevelopmental disabilities, the education gap, as we call it, is even stronger. So the more services you relied on at the time of the pandemic and the more losses of those services that happened, the greater the gap is in what happened for your child. I spent time talking to a couple of parents whose child had spent 2 to 3 years to be able to do some daily living skills, like just simple daily living skills, that because of the pandemic now they lost them, and it will take another 2 or 3 years before they'll be able to do that again. So there can be significant regression in a short period of time, and so my heart goes out to those families too. And so the more you relied on external services, the more impacted. Then we moved over to technology. Now, I want to say this before I get into my spiel about technology, is that most things that can do good also have the potential to also do harm. And the more good they can do, the more that balance is for as negative. It's sort of like it's this fulcrum, right? The more you can do, the more potential you have here. And so technology has a ton of good. Let me just say that. And I wouldn't be with you right now, this moment, without it. But it also has, if we don't control it, if we don't watch it, it has that much effort to do negative. And we are dealing, I'm sorry, I put myself in this same basket right now. We are dealing with technology addiction. We are. I did a community service talk a few months ago, and this sweet lady, she must have been in her 80s, said that she wanted help because she knew she was addicted to her screen as well. And it isn't so much that we're reaching out to make connection like we're doing here, meeting and talking and making connection. But we actually, do you know there are people who are paid a lot of money to figure out how to make that phone keep you on it, and how to make those games keep children in it and not socialize and not engage in their world and not learn language and have sensory problems. So I feel for teachers right now and parents, but I feel for teachers because after a couple of years of very technology life, we can't compete. We're not as interesting as what's on their screen. So, it's going to be a hard competition, but that's where we all have to learn to work together with this, because for those of us who know, if you go somewhere and they take your phone away for an hour, that you can't really have it, for whatever reason, or you decide during your meals, let me tell you that right now as an intervention, we'll just say it right now. If you can have one meal a day with your family without technology, the resiliency factor for children right now is huge. If we can even just do that, that would be huge. But if we can think about those moments when we do that, what kind of, we need that screen. We want that screen. We want that connection. We need that information. And so let's give those children a little grace that when we start doing this, that you don't just remove things, that you figure out what to put in there so that that they don't have that feeling of just emptiness and crying and behavioral concerns because of that lack. But we do know there are a lot of studies that show that, especially for our young, when they are on these screens and their brains are developing, it can really significantly impact that development. It impacts attention. I can tell you that for myself right now. My attention skills aren't that good. When I started doing reintegration talks about a year ago, I surveyed about 15 pre-teenage kids, and I thought, if you're integrating to school, they would talk about masks, or they would talk about sports or fears or whatever. The number one thing those kids said is, I hope our teachers don't expect us to pay as much attention as we did before, because I don't sit in front of my screen that long. And I don't focus on my math that long. I don't focus on my coursework that long. I have never sat for 40 minutes for a course period. So it was amazing to me that was the number one thing. But certainly, if you're on screens, you're not getting the right sensory input to your body. So that's an issue. And sleeping and eating disorders and obesity. So it's what I call techno-isolationism. We have to realize that our kids have been, for various good reasons, been promoted into technology, but we need to start looking at it like a prescription. And we need to say, no, I'm sorry. The prescription is, if you're 2 to 5 year old, 1 hour a day, 15 minutes max at a time, and never during meals, and never an hour before bed. If we want health, if we want to help start changing this trajectory, we have to think it like a prescription. I did put a resource here. It's called Reset Your Child's Brain. One of my good colleague friends who's an occupational therapist actually found this and shared it with me. And, some of the things in there, maybe we can't do them all right now, but there's a 2-week program on how to reset the child's brain. Do you know there's actually programs starting up, residential programs for kids to go to go for a couple of weeks to be detox from technology. So it's becoming a very significant issue. The other thing that happens, whenever we have stress goes up or economic concerns go up, the curve in our public health that goes right behind that curve is maltreatment of children. You're stressing their home environment, maltreatment goes up. And so what we were really afraid of, do you know, when we went into pandemic, it went down about 70% in some areas, 50 to 70% lower reports for maltreatment. Now, you were hoping that meant the world was a better place, but we knew it wasn't. It wasn't because the world was a better place. It's because children were not in the public eye, and no one was there to say these children are being maltreated. And we saw, as soon as, what we did see in our emergency department was more severe trauma. So the ones that came in were much more significantly impacted because they hadn't been identified early. And as soon as we started reintegration several months ago, like last fall, when things were starting to open up more, we had immediately a 32% increase of reports to the child abuse hotlines in our community, right, as soon as that started happening. So that is something that we need to take into consideration and realize these kids have been in homes and environments of stress. The other thing is the impact of substance abuse and the opioid epidemic. In 2019, we called it in the United States opioid epidemic, right? And what did they say just last year was the highest? I think it was over 100,000 people died because of overdoses. And unfortunately, drugs and alcohol were not hindered in terms of access. So this was something that has increased, and more children. So if you think about adults and we talk about overdoses, drug use, and that's increasing, you must, if you are a child advocate, in your mind also be thinking that children are also more likely to be exposed to those environments, because many of these people have children who are addicts, but also more children are being born with neonatal exposure and neonatal abstinence syndrome. And I am spearheading with some good colleagues from the Inland Empire a It's a kit, a resource kit for parents and caregivers for children when they're born exposed. And we're hoping to launch that this fall. So that's another thing that I think this community really comes together to say, what can we do to provide for these families? And the thing right here that I just know is so strong is the issue of mental health. It's for adults, but it is so devastating to see what's happening for children. I supervise the consultation liaison in the Children's Hospital, that service. And it used to be once every few months we had a child who attempted. But I'm going to tell you, the last, I would say from perhaps November until at least February, March, it's not quite as high right now, but it's still high. About 70 or 80% of our referrals were for suicide attempts or suicide ideation. And that's not in a psychiatric hospital. This is a, medical children's hospital. And it was particularly, if you look nationally, it's particularly for 14 to 16-year-old females, although children are both genders and children of most ages are just the mental health issues are significant. And in fact, the children's hospitals in the United States have called it a child epidemic, the suicide rates. And many, Colorado Children's Hospital was the first in May of 2021 to say this is an epidemic and we need to do something about it. I wanted to just spend a couple of moments on, how this works in terms of why we're seeing what we're seeing. So this was from the National Institute of Mental Health, talking about how the pandemic echo has impacted children and adolescents, and it has a whole more viewpoint of how it impacts neurotransmitters and cortisol and that in the body. We're not going to go into that because we don't have time today, but just look at the immediate consequences. And the reason that I'm highlighting these are for you to realize when a child presents to you right now, take this into consideration. It isn't just what you're seeing in the moment. It's what they went through the last couple of years. The distress and hopelessness, food eating problems, the abuse and trauma, interpersonal or environment issues, sensory deprivation, neglect, and the long term can be underdeveloped brain circuitry, which we are seeing, obesity, substance abuse, lack of emotional processing, psychiatric disorders, and suicidal thoughts. But I want to take a little bit more deeper look in this because I want you to start thinking about when children are presenting, how we traditionally look at them versus how we need to start looking at them right now. So let's remember that this chronic stress that they've been under can create permanent memories which shape how you perceive the world and how you respond to it. Don't forget that, because we take our experience wherever we go. We want everybody else to understand what's our story and how it's impacting how we present ourselves. Well, we need to do the same thing for children and realize that there's been an impact because of this stress and the hormones and the cortisol levels in the brain that has affected the prefrontal cortex, which is used for what? Planning and organizing and constructing your thought and how you organize your life. So let's be careful about our traditional diagnosis when we know that there's been chronic fear and stress. And that with this hyperarousal, we often see this more vigilance, more always looking around, inability to calm, which we see more in the older children and males, or that dissociation, kind of more withdrawn, parasympathetic response where you freeze or go blank, which we see more in the younger child and in females. So I highlighted some of the things you want to remember. With chronic stress, diminished growth in the left hemisphere, higher risk for depression. We're seeing that, right? But you know what else is on the left hemisphere? Language development. We're seeing a lot of language delays, and those go hand in hand. Irritability in that limbic system where your feelings and emotions, and so you're seeing more panic or more trauma symptoms, more kids frustrated and so acting out impulsively. So let's be careful about those traditional diagnoses and realize that's also a part of chronic stress. And the other thing is the way this impacts the brain, it affects the hippocampus where you have memory. So when you're depressed, think about when you're anxious or depressed. Memory's a little harder because the way that those chemicals are working on that side of the brain. So for some kids, you're going to see some more memory issues as well. And this impairment between the two hemispheres resembles, this is in the NIMH article, ADHD symptoms. So if we do a checklist right now and say, oh yes, they're not paying attention, they're impulsive, they're not planning well, they're speaking out of turn, whatever those are, yes, those are symptoms of ADHD, but they are also can be very much related to what children have gone through in the last couple of years or even in the last few weeks. And then this deprivation of that sensory experience in the world, playing on a playground with peers, all of that sort of thing, learning your body in space, we have the risk of sensory integration disorder. And we also have this disregard for the need for comfort or stimulation or affection, which are for relational disorders. So I want to tell you a little story right now about a child who we just saw, who came in because they did think that perhaps he had autism. In fact, this is a child who grew up in an environment that was not safe and was removed. So he's about 3 now, but he was removed from his parents because of the unsafe, drug-endangered environment and the drug exposure he had. And he was about 2.5 when he was removed. Now he's 3. He's gone through, how much of his life has been pandemic life? 26 months of it, plus all of that on top of it. And guess what his problem is? He's not relational. He's got sensory problems, and he's got language delays. And yes, those are all in the constellation of things that we look at when we look at autism. But it is also in the constellation of things that we look at when we think about the chronic situation he's been in. And that's been well before the pandemic that we see those overlap of those kinds of things, that some of these neurodevelopmental disorders and trauma so resemble each other. That was prior to pandemic. And right now, what I can tell you, it is even more exacerbated. And in some of the programs that I work with, where we work with children with mental health issues, it is huge the number of kids there with developmental delays because of everything that's happened. But we're trying to work on the mental health. And in where I am the medical director, where kids are coming in for autism, it's huge. Yes, the developmental delays and the things that are characteristic of autism, but the trauma is immense. And I think right now, if I can just, I don't want to go over too much. There's a lot more we could say and go into. But I think right now we need to start thinking outside of the box and outside of our tools. And we need to start meeting the moment. Meeting this moment, the children in this moment. That there is a high potential for misdiagnosis and mismatched interventions. Because if we just use our standard way of saying, oh, let me do this measure and see what it says, and don't take the history of that child, the ecology is what I call it, the relationship to their environment where they grew up, into consideration, we will not be putting children on the right trajectory. And I have such a strong passion that we work together as a community. Let's not cower from this wave that we're facing right now. It is huge. If we just look at the last 24 hours, like we were talking right before we let everyone in the room, it's hard to talk about yesterday because we all just want to get tears. It's hard to talk about the last 2 years for some of these families because it comes to tears. But if we don't, as a community, forget just cowering, forget ride it, but if we don't create it, if we don't create this wave, if we don't say, I'm going to purposely engage this agency and this agency, and let's work together because these children. And I think that we need to say also to our policymakers, you know what? Can you let insurances provide services to children because they need it, rather than us putting a diagnosis that could be on this child the rest of their life when it's pandemic based? And you know what? Our government has, California has, with regional centers, said there can be some provisional time, but it wasn't well explained. And with the regional center, if you give one of those diagnoses, they completely fall out of those provisional. They can't even get them. So it's a matter of us as passionate collaborators in this community to say, you know what? Let's think outside the box. Yes, we need to do our assessment. We might use the same measures, but let me find out a little bit more of the history. Can I find out from Child and Family Services at least something that could help me understand, do these symptoms really portray a neurodevelopmental disorder? Or maybe they do have that with the trauma, but I need this complex understanding of this complex situation through comprehensive evaluation. And some of our centers do comprehensive evaluations. But if you're in a standalone place, try to find someone to work with you, so that, because we need a community of providers to wrap our heads around, is this pandemic? Is this biologic risk? Is this a neurodevelopmental situation? Is this because, and here's the key, because I don't know, for some reason I want to share this with you as we move over to the questions. But a couple of years ago, I was speaking to a group of very well respected providers, where I was talking about that it's really important that they consider the diagnoses that they give children, because it does impact their trajectory. And that symptoms aren't the explanation of a diagnosis. Symptoms are only a portrayal of what's happening behind that child, and we need to find out the what's happening. We need to find out the etiology, because if I came to you and I had a headache, you wouldn't do a surgical procedure on me until you found out really where it was coming from. But for some reason, when it's behavioral, when it's mental health or behavioral, we think, well, you know, it's a treatment. What harm can it do? But let me assure you, because I've seen children over the years who don't get the right treatment, or get the wrong treatment, or who don't get treatment, or who aren't considered for the fact that they have multiple needs and may need multiple avenues of treatment. If we believe that behavioral services makes a difference, that providing for mental health and behavioral needs makes a difference, then we have to admit the fact that how we make the decisions of what treatments children get and what diagnoses they get is important, and it does matter. So when we talk about trauma and we talk about delay, remember, who's the child in front of you? What's their story? And let's meet this moment, as hard as it is, together, and be a community that gives grace, a community that supports each other, a community that advocates for children, and a community that's going to create the wave and help the children grow. Thank you.
Thank you so much, Dr. Kiti. I am, as a parent who raised a child in the pandemic, I have learned a lot. And as somebody who works in this field with everyone here, I am really profoundly moved by the call to action that you have raised for us. I recognize, that we only have about 10 minutes. So I want to try and get through questions as much as possible. One of the things that, while questions might be added in the chat, I do want to just take a moment to think about the fact that we have such a diverse group of providers on this call, and many of which are working with families in many different aspects and ways. And so I'm really curious to hear from you when you think about what are those opportunities that providers should be using to encourage families to implement, strategies at home. Like some providers may only have a couple of minutes with them, right? And so what are some of those things that they can offer up to families to help sort of help connect the left and right hemispheres of the brain and strengthen those muscles, and sort of promote that resilience?
Great question, Iris. And I believe that there are things that we can do to help provide those supports around children. So if we look at trauma particularly, and any child needs this, but certainly children who've gone through what they've gone through in the last few months, is there's three branches. I do four branches, but if you look at the trauma literature, there's three branches that if you can help a family incorporate those in the life of the child, you have done a lot to start that. Just start that. And the first one is routine. So if you can, and there's a lot of literature that came out in the last few years just saying, hey, everybody, you're at home, but try to keep a routine, have a bedtime, have a get up time, it is so critical. And part of that is critical, yes, for how we function daily, but the reason it's so critical for our children, particularly those who've experienced stress and trauma, is because if you have a routine, you know what's coming next, and you don't have to be so vigilant to your world all the time. What's going to happen next? There's so much ambiguity around the pandemic and other things in life that if you can have a routine in your home, it makes a huge difference. And often parents, I'll say, when do you get up? Well, it's between 6 a.m. and noon, or the meals are here or that. If you can at least get a wake up time, a go to sleep time, and a time for meals that is very consistent, you've done a huge part for resiliency. The other part is boundaries. And for many parents, I talk to them about, the kids have gone through so much, and we want to say, oh, I'm so sorry you went through this, so I'll give in. Okay, so pick your battles and make sure that whatever your word is, you can keep it. If you think about Las Vegas, right? If I go there and I put a coin in, it could be 1 time, 10 times, 3 times, 12 times, whatever. But every now and then I get a reward because money will come back out or whatever. If a child knows, and remember, they have more energy than you. If they know, oh, you know what? Might be 10 times this time, 3 times, 4 times. That's called variable reinforcement. It's what Las Vegas knows. You will never give up that behavior. It's so addictive. Well, that's how it is for parenting. If you say no, please say no. If you have a boundary, please keep that boundary, because you're not doing the child any favors. And I hate to put it this way, but in many ways, the child will just see you as non-trustworthy because you don't keep your word. So let's not put out words out there we don't want to keep. Let's be gracious about how we say things or what we want to say. But when we say it, let's be true to who we are and what we believe and what you want the child. So pick your battles, but boundaries, really helpful. And especially for children who had trauma, they need to know somebody's out there with boundaries, protecting them. Mm-hmm. And the other thing is nurturance or love. And we didn't get to talk about resiliency today, my favorite topic. And let me just say this. The number one thing, you can take thousands, and a colleague of mine did, thousands of articles on resiliency. There are multiple factors, but the number one factor for resiliency is relationship with a healthy adult. So if we can keep ourselves healthy and be there for the children in our community, it is huge. The fourth one I add, that's not so much in the trauma literature, is what you might call spirituality or meaning making. But give children a sense of purpose in your home, in your family, in their life. They're here for a reason, and let them know they're cared for and loved. I think that's a huge part of it. And for people who have a certain spirituality, share that they have a meaning within life for some reason. They're here for a reason. Very important.
Thank you so much. I love those 4 really easy to relate to and communicate messages for providers working with families. I see a question around realizing that parents and caregivers might be reluctant to challenge a provider's diagnosis. What are some tips that we can offer them as people that they work with to allow for a respectful conversation in those types of situations?
Yeah, and I like the word respectful. I think it's always the way we deliver, but I think parents, we need to help them to realize that um, they need to be able to say, I'd like to seek this out further. So if they get a diagnosis and they're questioning it, the number one thing I would say for them to probably be able to do it in a way that doesn't challenge their provider too much is to go to the insurance company and just say, hey, and I hear it from the insurance companies all the time, just tell the parent to call us. They're welcome to get a second opinion. Or I would challenge the provider to please, you're providing me this diagnosis. It has these elements in it. So can I also see a specialist who might assess that element? So, for example, if they go to a physician who says, oh, it looks like you have a behavioral disorder, it could be autism, it could be ADHD, whatever. Oh, I understand that psychologists or occupational therapists or speech and language can provide a lot of information about that. Could you please refer me for that so that I can get their input as well in terms of the needs of the child as well? And I think just telling them that they'd like more information. The problem right now, and this is where it's really hard, is that people have been desperate for a couple of years for getting help, and the wait lists are so long that because I will be honest, I've talked to some providers and I said, why did you do that? Why did you know that it's because it was in their toolbox and what that was the only thing they could get them to at the moment. But I would tell parents, don't give up, because I don't believe anything is static. I don't believe a diagnosis is static. I don't believe that anything like that is static. A behavior doesn't have to be static. A developmental, I have seen amazing things happen. Now we have to live within the realities of the now and get the right treatments and not be in denial. But keep pushing, keep asking, keep advocating.
Thank you. I know we have just a couple of more minutes, but let me just ask one more question. With regards to the techno isolationism, I know as a mom, I'm guilty of it myself with my 2-year-old. Are there certain, quick, easy techniques to help kind of reset the child's brain, especially if they've spent the last 2 years digesting so much of it?
Yes. So one of the things that I mentioned was that you can't just take it away without putting something there. So please remember that. It's if you've ever worked with addictions too, it's like if the people were stopping to smoke, we needed to put something else in their mouth, like a peppermint or something. So so with kids too, don't just yank it away. Put something in its place, but do have some boundaries there too. So I would say the great things would be reading with your child or imaginary play with your child, doing family outings. Things are opening up, so there are things we can do in the out of doors. The more out of doors sensory experience, the better for them. But in that book, and I might actually want to maybe stop my share and put in the chat, I'll put my website. Let me see, where's the chat? For some reason, I'm not seeing it.
We can always send it out too afterwards to everybody.
Okay, so in my on my website, there's a page. So it's timeindrkitty.com, and there's a resource page, and it has Dr. Dunkley's book, and in it, she has a 2-week program for trying to reset your child's brain. So she's put a lot of thought into it, and I think it would be a really good, helpful thing. But if you think about what is it I can put in place that provides sensory experience that the child's getting from that? So one of it is games, so doing board games together as a family. One of it might be learning about certain things. So if the child has an interest in trains or dinosaurs, robots, whatever, getting books on that, having after school going and getting a library book, or, just trying whatever's permissible for your family and in your environment to capitalize on where the child is at. And one caveat I would have there, Iris, that I didn't get to really talk about is to think about it developmentally. So these children, many of our children right now, they may not be, let's say they're 5. And even though they were doing well developmentally, they're now acting more like a 3.5, 4-year-old. So think about the fact that, development is so much that if they're 5 but they're functioning here, that gap in between is called frustration. Okay? So if I am 5 but I'm really 3, but you're expecting me to be here, nothing but frustration in between. But if I come to 3 and I help promote and push it up, right? Then I'm going to get you back to those skill sets. So don't try to have your child do things at the age they should be chronologically. Find out where they are developmentally and help promote those skills up. So get books that they're interested in, even if you think they're for much younger kids. They might have missed out on all of that, reading, storytelling, all of that sort of thing. So think about it developmentally, and where can you meet them where they're at that could get their interest to you away from the screen. Kids actually do love being with you.
Yeah, I love that. The movement back to connection is so incredibly important. Thank you so much. I know we are at time, and it feels like we need to do a part 2 of this conversation because there's so much that we didn't get to. So thank you so much, Dr. Kiti. I've learned a lot, and I think it's just so timely given everything that is happening in our world today. And so really appreciate your wisdom and your experience with us. To everybody on the line, as you know, we have a third part of our series. So our team has added the link to register in the chat. We'll send out the recording in case you wanted to, revisit something that was really powerful and interesting for you. And then what we will do is we'll send out an email with the recording and some additional information for you. So any resources that Dr. Kiti shared will be included in that. And, we really, really appreciate you being here with us and taking the time out of your day. And hope that you stay well and take care of yourselves and your families in this time. So thank you all. Really appreciate it. Have a great day.